Hi there, podcast and public radio fans. Heath Drusen here, host and creator of the Extremely American podcast. I'm working on season 3, which is an urgent story about neo-Nazi terrorists and how they helped build a modern white supremacist movement, even from prison. Some of their ideas have even made it to today's White House. It's both a gripping true crime story and a timely warning about threats to our democracy. And this time, my investigative reporting is funded by you. To support the project, please make a tax-deductible contribution at extremelyamerican.org. That's extremelyamerican.org. And thanks.
From the studios of Boise State Public Radio News, I'm Samantha Wright, filling in for Jim Gaudette. This is Idaho Matters. Idaho Health and Welfare is concerned after 60 people got sick from raw milk from the gem state. The dreaded screw worm creeps closer to Idaho. Could that push the price of beef higher? And did you know that dogs get dementia too? There's a new study of man's best friend that may help humans suffering from dementia. It's Wednesday, time for our Doctor Roundtable with Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book Preparing for the Next Global Outbreak. Dr. Pate, good afternoon.
Good afternoon, Samantha.
And if you have a public health question, send us an email, idahomatters@boisestate.edu. Okay. Dr. Pate, this came out last week. Idaho Health and Welfare Department says almost 60 people have gotten sick after drinking raw milk. 45 of them tested positive for a bacterial infection. What do we know?
Yeah, so we know that this is a frequent recurring problem with raw milk because our pasteurization process kills these various bacteria and viruses, but we have at least 2 different farms and different parts of the state where they're selling raw milk, and people are purchasing that thinking that there are health benefits to that, which there are not. There's only health risks. And what has happened is there's quite a number of bacteria that are frequently associated with raw milk. One of them, this one, Campylobacter, has been detected in, as you said, the majority of those that have become ill, but not everybody has been tested yet, so we don't know. And it certainly is possible to have an infection with more than one or to have different infections, but it's certainly a big outbreak of Campylobacter, probably more cases than what we know about. And this is the fact that the milk is not being pasteurized.
Okay, and you're talking about if the milk is how does that pasteurization affect the milk? And you're saying that it takes out those bacteria. Does that, when you pasteurize milk, does it change the nutritional value of the milk? I know a lot of people drink raw milk and think it's healthier for them. I know you don't necessarily agree. Does it change the nutritional value of the milk? Are we still getting good milk when it's pasteurized, I guess is my question.
It does not change it. And yes, we're still getting good milk. People, I think, don't understand the pasteurization process. It is heating it to a high temperature for an extremely short amount of time. It's not like you're sitting there boiling the milk and having it all, evaporate and denature and so forth. This is a very quick process. It's quick enough to kill bacteria. And in fact, we've also shown that it will kill the avian flu that gets into cow's milk. And that's important because right now, Idaho has the most cases of avian influenza in our herds. We just had 25 herds turn positive for avian influenza. We now have the second highest number of farm outbreaks in the country. And so not only would I not want myself or my children to be exposed to Campylobacter, E. coli, Salmonella, Listeria, the common kinds of bacteria that we see with the milk. This is a new avian flu variant, and I certainly would not want to be giving that to my child. We just don't know enough about that one yet. So it does not affect the nutritional value of milk. The claims made that raw milk is better for you is by people that have a financial interest in you buying raw milk. And there is no benefit. And as I said, only risk that you're going to get one of these various infections. And many times those infections will just make you miserable for a week or so, and they'll resolve. But certainly, it puts kids in the hospital every year. We certainly see life-threatening cases in particularly young children. But it can be very dangerous for pregnant moms. It can be dangerous for the elderly, for those that are immunocompromised. So it's not a good idea. I know people think that because of the claims made, this will be good for your health. It will not.
So what kind of symptoms are we talking about? You mentioned people could end up in the hospital. What sort of symptoms pop up with this kind of thing?
Well, it does depend on which bacteria. I listed four. The current one, the Campylobacter, typically, and for the others, is we're typically going to see diarrhea is probably the most commonly reported. There are a couple of these bacteria that are more likely to cause it to be bloody diarrhea than the others. But diarrhea is a feature of most of them. Fever is not uncommon. Stomach cramps, nausea, vomiting, all of these things. With this particular bacteria that's causing the current outbreak, Campylobacter, typically we see the symptoms emerge about 2 to 5 days after consuming the milk.
And we had a questions. Are there any other steps that raw milk producers could take to reduce the risk of contamination aside from like pasteurization, or is it pretty much there's always going to be a level of risk with raw milk?
Well, there's always going to be a level of risk with raw milk. Yes, you can certainly. So what happens is that these bacteria are carried in the cow's intestines. The cows on a farm poop, and the bacteria comes out with their poop. And then it gets into the ground. And then cows like to lay down on the ground. They like to. They don't mind getting a little dirty and all. And so you can, unfortunately, the teats to the udders are on the bottom side of the cow. Those are on the surface that is going to come into contact with the ground. Not infrequently, when they go to milk the cows, they're going to have manure and soil on their underbelly. And so certainly if you take care to wash the underbellies of the cows, some places will apply iodine and do other things to try to cleanse the area. But the fact is that even with those steps, we continue to see outbreaks of these illnesses, and we do not see them with pasteurized milk. We've got study after study that has confirmed that the pasteurization process is extremely effective. And again, it doesn't those that are proponents of raw milk, like I said, they typically have a financial interest in it. But saying that, well, it breaks down the nutrients, no, it does not. They sometimes make claims that, well, it damages the antibodies that are in the milk. Well, no one showed that having cow antibodies actually helps you. Even if it did, I don't know that that's a problem, but it doesn't break down the antibodies anyway. And so the claims are just baseless. We have studied this for decades, and we know that all of the nutritional benefits of milk you get from pasteurized milk. There are no additional benefits you get from raw milk. And with pasteurized milk, you don't get the risk of these sometimes potentially and always at least, distressing symptoms and problems. And so really taking raw milk, it's all risk and no gain.
Okay, and if we didn't turn you off your lunch talking about cows, let's talk about screwworm, because it's not a day with Dr. Pate and I if you haven't talked about screwworm. The governor of Texas is upping his state's response to the New World screwworm, and that's why it's in the news. Dr. Pate, remind us about this bug. We've talked about it before. Quick recap, what's the screwworm?
Yeah, so it's actually a little bit of a misnomer because it's not a worm, it's a fly. But the reason it's called the screwworm is that the female fly will look for any kind of break in the skin of warm-blooded animals, and then it will find that place and decide that is a great place to lay her eggs, which she can lay up to 2,000 eggs. And when these hatch, they are like little tiny worms, maggots, and they, in that larval stage, they can then begin like a corkscrew in the top of a wine bottle. It just starts screwing in and going deeper and deeper into the animal, and then can certainly be life-threatening to the animal, but it likes to get in there, and they are very challenging to deal with, which is why this is not good news that it's back. We've already gotten rid of it once.
Okay, and they've been finding the screwworm, the fly, in cattle in South Texas. They found them in June 4th. Okay, so where is it coming from? If we got rid of it in America, where is it coming from now?
It's hard to know whether it was Central America or Mexico, but it was one of the two. Basically, the Central America has been having a significant problem with the screwworm for the past 3 years. And it eventually has been moving up northward and got into Mexico. And so last year, the idea that we had to combat this was to put in a border closing for livestock to be imported from Mexico. But that will certainly take care of the problem of cattle that are infected. But obviously, that's not going to stop flies. Surprise, surprise, here they are now. And so only in April did we decide to start building a facility that could counter this problem. The problem is it won't be ready till November of 27. So we're a little bit late to the party here.
Okay, I think I read the USDA has sterile flies that they think will try and stop the spread, releasing them in Mexico. I think I also read that as soon as Texas said it had the fly, the screwworm, Canada reacted and banned cattle from Texas temporarily. That becomes a monetary issue and a commerce issue. There's been speculation this could cause higher beef prices. And like you said, this doesn't just affect cattle. We've been hearing a lot about the cattle. It's not just cows.
Well, that's correct. I haven't seen an official report, but I did see someone reporting that a dog in New Mexico now has screwworm, and they can certainly infect other animals besides cattle. Cattle is where we usually see the big problem, but they can even infect humans. And so yeah, and the deal about the flies is that what we learned, because we had a problem with these screwworms back in, I think it was in the 60s. And the way that we dealt with it was we figured out how to breed sterile male flies. So the male fly cannot fertilize the eggs of the female when we breed them to be sterile. And so they mate with the female, but the eggs are not fertilized. And so when the female lays the eggs, they don't hatch into larvae and they don't cause the disease. And the female fly only does this process once and then she dies. So it is a very effective method for us to be able to control the spread of this, because it just causes the eggs not to hatch.
Okay, and as we know, Dr. Pate has a new scale of danger for things like this. So, on your scale of danger of 1 to 10, how concerned should we be about the screwworm in Idaho? Not just people, but the cattle industry.
Well, cattle do move around, and especially if we can't get this under control, then it can be an issue, because in the winter months, many cattle farmers do take their cattle south. And so, obviously, if we don't have this under control, that's going to put those cattle at risk. But I'm hopeful that we can really focus our attention on this and contain it, and then hopefully it won't be. I do think it is going to hurt us from the standpoint of what you said, other countries not wanting to take our beef and take chances on that. So that will be some economic pain there. If we don't get it controlled, obviously that will lead to more cases and then more cattle that will be lost. And so that would be a financial hit. So I think the risk to us personally in our health is very low. But the risk that this could hurt cattle farmers, it's medium right now, somewhere in the middle level. I think this is not good, and our delayed response is going to make it harder to get this under complete control until probably the end of next year.
Oy. Okay, I want to switch from icky flies to brains, and I want to talk about Ralph the dog. Ralph the dog was featured on 60 Minutes Overtime. He was an ordinary dog. Looks like maybe he's a lab mix, something like that. He was ordinary until he was diagnosed with dementia. Dr. Pate, I didn't even know dogs could get dementia. Is this a thing?
It's a thing, and the and now I'm not a veterinarian,
I
so
know.
if anybody listening to the show is a veterinarian, please pardon me for my attempts to explain this. But in older dogs, sometimes they can appear confused, anxious, kind of pacing around. And things that a younger dog might have no problem with. For example, if you showed them a treat, put it down somewhere, but you had the dog trained and you were making the dog stay at your side, and then you were to let the dog go a minute later, the dog would normally remember where that treat is and go right after it. With a dog with dementia, they will forget these things very quickly. It would not be surprising for that dog not to go where they saw you put that treat because they can't remember. They may just kind of seem anxious, pacing, not resting normally, confused, those kinds of things. So, yes, it certainly can happen to dogs.
Okay, Ralph joined the Dog Aging Project. And if I understand this right, he's one of 50,000 dogs that are helping scientists learn more about humans with dementia. And they're comparing the brains of dogs and people with dementia, finding some of the same things. What happens to a brain, a human brain, when you get dementia that, we could look at with dog brains too?
Yeah, so there's some similarities in that what happens in a lot of cases with dementia, but I want to first of all mention there are many different types of dementia, and those in humans, there are many types, and depending on the type of dementia, they can have their onset characteristically at different times. There are some dementias that will, fortunately, they're much less common, but they can occur in someone in their 50s, earlier. There are other dementias that we typically don't see till much later in life. There are some dementias that are rapidly deteriorating, others that slowly. So, not all dementias are the same, is my point. But what is typical for many dementias in humans is a loss of neurons. Neurons are brain cells, and they are the ones that send the messages to other parts of the brain and to other parts of the body. And what we see in many dementias is a loss of neurons. And what happens in the brain is oftentimes the part that is affected shrinks. And when it shrinks, it creates a bit of a vacuum that can be filled with fluid. And so we can oftentimes see abnormalities on our scans and all, but you can see it when you remove the brain and transect it. And what they are finding with the dogs is a very similar type of appearance. And so there is hope that dogs might turn out to be a good model for us because we don't have a good animal model for Alzheimer's disease. And because most animals don't either live long enough to get Alzheimer's if they can get it, or they don't get Alzheimer's. We're not really sure. But we don't have a good animal model. If it turned out that on further study that when we look, microscopically and we look at the actual proteins involved, something called proteomics and all, when we look at the dog brains, if we see changes that way that very closely resemble what we see in human brains with Alzheimer's. Now, for the first time, we might have a good animal model. Why is that important? Well, we can more easily examine the brains of dogs than we can of humans, obviously. And in dogs, their lifespan is quite shorter than ours. And so, if you have to wait, especially for people with the normal type of Alzheimer's disease that can go on for decades, it could be a long time to be able to do study follow-ups and look at their brain, because you can't do that until they're dead. But dogs don't live as long, and so we can speed up our research. We can also, it's easier to do trials for various potential drugs that we think, based on understanding what's going on, what might work. You can do more studies and faster on the dogs. So there's a lot of a benefit to having an animal model, which we just haven't had. So we're optimistic, but I would say we're still, at least based on what I've seen, and again, I'm not an expert in this area, I don't think we have evidence that the dementia that dogs get is actually pathophysiologically the same as what humans do. But it could be. That's a matter to still be answered.
All right. Dr. Pate, we've got a question from Sunny in Haley, who wrote, I'm wondering if the rhinitis laryngitis is a virus currently going around, perhaps COVID, flu, or cold. Sunny says, I was at a hotel event in Nebraska in mid-May, attended by folks from all over the country and some from other countries, and a couple of us have come home with this laryngitis caused by this. I'm 78 years old, current on all vaccinations except the latest 6-month COVID booster, and has no other fever or symptoms. Dr. Pate, what's this mystery?
Well, it's going to be a little bit hard to tell without seeing and examining Sunny, but
Yes.
Sunny, I thought it was going to be an easy question until you added some facts. If somebody, if you had told me that you've just been here in Idaho and just recently developed your symptoms, I would say it's a good chance it's not even an infection. It might be allergy. So, for example, grass pollen is very high right now. Molds are kind of medium, weeds and trees are low, but it would also be unusual for someone your age to develop new allergies. So if this wasn't something you were familiar with getting all this time, but I thought maybe that's where we were going, because the respiratory viruses here in Idaho are all pretty much on the low side. Doesn't mean it couldn't be. But what you did is you threw me for a little loop, because you said you went to Nebraska. So I looked up Nebraska, and I don't have data from back in May when you would have been there. And there probably was more influenza there than now. But they're currently low like we are. And so I thought, well, okay. But then you said there were people from other countries there. Now all bets are off because we have different versions of the COVID virus circulating in other parts of the world. And so, and frankly, some that we haven't seen here for a while. So that could certainly be a candidate. We are at the end of our flu season, but there are some countries, if there were people in the southern hemisphere, that may be getting close to the beginning. And so maybe that's an issue. So basically the answer is I cannot tell you. But what I would say is, if you've been, and the other thing I would say is that because you said there were some other people that were there that had the same symptoms, that now is very suggestive for a virus. because I wouldn't expect that to be the case, and if it was allergies, unless they were people coming here with you. So I would say probably with this lingering, as long as it has, probably a good idea to see your doctor, because it's much easier to sort these things out when I can ask you a bunch of questions and examine you.
Good. Okay. And we got another question. And Dr. Pate, you haven't seen this question. I'm going out on a limb with what I know about you and guessing you can answer it. So we'll see. Here we go. The question says, a friend of mine recently had her first grandchild. She was talking about the baby and all the immunization she has to have, and asked me, the questioner, if I knew that there was mercury in immunizations and that it can cause autism in some cases. Can Dr. Pate spread some light on this? Again, from the questioner, from what I'm reading online, the use of thimerosal has been mostly eliminated from childhood vaccinations, and any trace amounts that are present are safe. Okay. I'm guessing you can answer that, or you want to answer that.
Yes, well, I can. So, first of all, there's no need for concern. There has long been this concern, really going back for decades, about mercury, and we all know that when women are pregnant, we ask them to watch their mercury intake in their food through things like tuna, fish, and things like that, because it can potentially be harmful to the developing fetus. But that is not the same thing as thimerosal. And this is where the people that promote vaccine disinformation like to confuse the public, because it sounds very scary that there is mercury or was in some of these vaccines. The studies have been done. There is no harm from the thimerosal. But even so, this had become such a thing that it was just decided, rather than us having to constantly go back and tell people, no, that's it, you're not getting dangerous mercury. This is not something that's unsafe. Basically, it's been taken out of almost all the vaccines. The only ones where there's small amounts are ones that probably you're not getting anyway, like in some multi-dose flu vaccine vials and so forth. But very few vaccines have it. The ones that have it, it's perfectly safe. But just to say, no, this is a common tactic to scare people. You need not be worried about it. Thimerosal is not the same thing as the mercury that most people think of, and the thimerosal is not harmful. And study after study after study, and this has even been looked at with new studies lately, still does not show any association with autism.
Okay, we've got just under 5 minutes left, Dr. Pate. So this is going to be fun if we get this in. Nantucket has been having an outbreak of Lyme disease, and there's a project known as Mice Against Ticks from MIT where they're using mice to stop Lyme disease. Can you explain how this works? Because this is wild.
Yeah, this is very clever. Lyme disease is always an issue in the upper Midwest and the Northeast, and Nantucket is been a frequent location for where one can get Lyme disease. I think of the residents there, something like 15% of them have evidence of Lyme disease. And it's because of the fact that the bacteria that causes Lyme disease is that the host is a mouse. And the what happens is the mice have the infection. Ticks black-legged ticks get on the mice. They suck the blood. They get engorged. Then they go off of the mouse, and then they will latch on to whatever could be humans and inject the bacteria into them that way. But they also they love to just ride along on deer. Deer don't get infected by the bacteria, but the ticks love to ride on the deers, and they can feed on the deer's blood. And so where there's interaction between humans and the deer, and there are a lot there, you get these ticks. They can get into humans. And so what they're talking about is genetically altering the mice, which we now have the technology to do, to put in a gene that basically makes the antibody that would protect the mouse from the bacteria. So now the mice don't get infected. They don't have the bacteria. Then if a tick feeds on it, yeah, they'll feed on it, but they're not going to get this particular infection and then transmit it onto a human. So very clever. We'll see if it works.
Wow, that is not what I would have thought of. So that is fascinating. Wow, I knew that that the ticks like to ride along on the deer. I didn't realize that the deer don't get infected.
No, this is one infection that they don't get. Now, there's a lot of other ones that they certainly can get, but they don't get this one. And so it is a very clever approach. And I think this just is all the more reason why we need to continue to fund science. We can find these kind of innovative approaches to making our lives healthier and eliminating some of these health risks. So this is very encouraging. We don't know if it's going to work yet, but it's going to be tried, and that's what's important.
Well, and I think this is the second thing we've talked about in this hour that's a little different. Sterile flies, and now mice. How do I want to put this? Lyme disease repellent mice. So
Yeah.
I think it's fascinating. Dr. Pate, as always, thanks for taking us through the public health news quagmire and making it make sense.
My pleasure.
We've been speaking with Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. If you have a public health question for our Dr. Roundtable, just send us an email. It's idahomatters@boisestate.edu, and we'll answer it next week.
Thanks so much for listening to this episode of Idaho Matters. And for quick news of the day, start your mornings with our podcast. It's called The Connector, Idaho Daily News. And if this episode meant something to you, text it to a friend.
Each story you hear on Planet Money starts with a question. What happens if we refund tariffs? Why are groceries so expensive? At NPR, we stand for your right to be curious, because the forces shaping our world can be hard to see. Follow NPR's Planet Money wherever you get your podcasts and start seeing how the economy really works.